criminal that 1,000 women are still dying in pregnancy or childbirth when we've seen such advancements in medical technology.
It's great that you're able to start your walk to London here at this historic building where suffragettes and many others have started their campaigning on behalf of women and women's issues.
Oxfam's campaign, I think, is to concentrate and make sure that we all recognise that a little bit of genuine human compassion can save not simply one person's life, but can save the life of the whole family.
My name's Esther and I'm an intern at Oxfam.
And I'm Lottie.
And how are you both feeling about Prambling this morning?
Very excited.
You're excited?
Could barely sleep last night because of it.
And how much walking will you be doing today?
I'll hopefully be doing the 10 miles, but we've got a dog with us who's quite old, so he might make us stop a bit earlier. But I want to do the whole thing.
Fantastic. Yeah. And there he is. He's excited about Prambling.
Very excited.
Thank you very much.
Thank you.
I'll be walking from here all the way through to Withington in my constituency, and then I've got to go to do a surgery, so I'm not able to go all the way to Wilmslow, unfortunately, this morning. But hopefully the walk will warm us all up, because it's absolutely freezing this morning.
The Manchester group have been amazing, done loads and loads of work, and lots of people around the country as well. The plan is lots and lots of people walking, lots of parties along the way, lots of pram pushing, hopefully lots of the public being involved in getting excited about what we're doing as well. So, good.
Here, you've got them here in front of you. We're walking all the way from Manchester to London. As I speak, 1,000 women die every day in pregnancy or childbirth. There is a woman a minute. There is a woman too many, and that's why we're here. And we don't want this to happen anymore. Oxfam Pramble, look at the sky, looking beautiful, so far.
All of these messages are messages of support for our campaign, which is about maternal mortality, and I know the government has made some commitments to trying to reduce that through its aid. And what we're really asking for is that that aid be directed towards free healthcare, which enables women to be able to access healthcare. In Sierra Leone, where that happened through previous DFID funding, use of healthcare has increased 179%, which obviously is going to have an impact on the maternal mortality and infant mortality statistics. So what we're really asking for, and what all these other people have supported, and over 100 walkers are taking this message down to London, just saying that we think that free healthcare is really important, and using British taxpayers' money, DFID funding, going into supporting that will mean that the number of women dying unnecessarily through a lack of healthcare will be able to reduce, because they'll have that access to healthcare.
Right on the first day this government came into office, we said that we were going to seek to put women and girls right at the centre of British international development policy. And our Prime Minister announced at his first international summit, the G8 summit in Canada last year, that we were going to put maternal mortality at the top of the international agenda for the MDG summit in New York last September. And Britain announced that we would focus particularly on saving the lives of 50,000 mothers in childbirth and 250,000 children. And also, actually, very importantly, seeking to get contraception to those who don't have it, so that women can choose whether and when they have children. So this is an extremely important campaign, and together Britain is going to make a huge difference in this area. Your government has heard these voices and is absolutely intent on making a difference.
The Pramblers have arrived.
Catherine.
And I'm Lucy.
It was loads and loads of fun, in the sunshine. Pretty tired now, but we've had very tired. We've had a really nice reception to arrive to in Birmingham. So yeah, it's been really fun. Keep campaigning for free maternal health care, and yeah, just keep up the good work.
Here they are, the men of the moment. I may have found my megaphone. Everybody happy?
Brilliant, yeah. We've done, I think we've done 11 miles so far, so it's been good, yeah, I've enjoyed it. Lovely weather, very nice scenery. It's been alright.
And why have you decided to do the Pramble?
We decided to do the Pramble because I think it's a really good campaign that I was keen to support, and conveniently enough I'm also training for a marathon, so it was a really good way of being able to do that too, and it's a day out of Oxfam House as well, which is nice.
Always good. And are you looking forward to finishing?
Yeah, I think so. Yes, I will be. I'll be glad to. It's as enjoyable as it's been. I'll be glad to finish, definitely.
It's a great course, and it's great to get down, taking the message about mums in the developing world, and taking it to everyone from Manchester all the way down to London. So it's great.
1,000 women a day dying in either childbirth or soon after giving birth is absolutely unacceptable. And if we put in the effort here, maybe they'll see how much people in this country care, and they'll put in the effort to support countries with free healthcare.
From Manchester to London. We have been doing it for 2 weeks. They're lovely people, all different people. So thank you all so much for coming out and looking at our beautiful pregnant giant as well. In wish to walkers all the best for the rest, and they're going to be arriving in London on Saturday the 2nd. Great stuff.
I think it's really incredible. It's been fantastic to hear about people walking all the way from Manchester to London. I know sometimes in relays, but great that it's been done, and great that it is so symbolic about maternal health and the great cubes in the prams as well. The message is we've already seen wonderful differences in Sierra Leone about how women now are coming through childbirth and their babies saved as well. That's just absolutely fantastic to see. Go and tell the minister that actually we want more of this, we want some other countries covered. It's really important that healthcare is free, and it's really important that governments put the money in behind that so that people can get the healthcare they need. And it's just really wonderful that the Pramblers are showing, you know, they're really committed as well. Just go to it and tell them.
The UK government has made a commitment that we will ring-fence the international development budget, that we will step up to the promise of 0.7% of our total gross national income will be spent on international development issues by 2013, which is a real leadership promise, and that we will enshrine that in law. It's not the money that matters, that's the resources that are a means to an end. The question is what results to achieve in terms of improved access to safe childbirth, interventions in pregnancy. How do we make sure, as we will, that 10 million more women and girls will have access to family planning over the next 4 years than they currently have? How do we make sure that 2 million more women get an accompanied birth? Women and girls are front and centre of every policy now in DFID. If you get it right for women, you get it right for development. The power comes from people demonstrating their determination and their will, and the Oxfam Pramble has been a very fine example of just that.